Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then we have something called as semi-closed circuit. Okay, what do you see in semi-closed circuit? See, we have three circuits, like open, semi-closed and closed. Open we are not using now. So now let us learn about first semi-closed circuit. In semi-closed circuit, we give see, I'll just show you here. Did I draw a diagram? No. Okay, I'll draw a diagram here. So think that this is the machine, anesthesia machine, and this is the patient. Okay, so from the machine pumps inspiratory gases to the patient. Okay, now this patient takes the inspiratory gases, and all the after the patient takes the inspiratory gases, this the metabolism occurs and expiratory gases are generated. These expiratory gases are released into the atmosphere. So this is the semi closed circuit, where all the expiratory gases are released into the atmosphere. Okay, so this is less economical, right? Because we are losing the some amount of gases which can be reused again. So there is wastage of gases, so it is less economical, right? And because these gases are released into the atmosphere, there is an increased chances of operation theater or atmospheric pollution. See, the gases which we give are anesthetic gases. We give oxygen. We just do not give oxygen 100%. We give nitrous oxide, we give oxygen only 21%. The rest all will be the other gases, right? So nitrous oxide which can be reused, right? So all these gases, especially the vaporizers, and if you see the anesthesia, uh, general anesthetics, inhaled, sorry, not general anesthetics, inhaled anesthetics which we give, all those they can be reused. Okay, so if you see, there is increased atmospheric and operative pollution also. So in this case, okay, this is one thing. Okay, then if you see, the controlled mode of ventilation and spontaneous mode of ventilation both can be used in this semi closed circuit. Okay, you can use either controlled or spontaneous mode of ventilation. If you have to use spontaneous mode of ventilation, then the patient is not paralyzed. Why? Because as I said, in spontaneous mode of ventilation, the respiratory effort of patient is very important, because in spontaneous mode of ventilation, the machine does not do anything. The patient has to take his breath. So as a result, the patient should not be paralyzed. Okay, in controlled mode of ventilation, there is no need for the patient to take the breath. The machine itself pumps the necessary amount of air which is set by the doctor, right? So in this situation, the patient is paralyzed. If patient is not paralyzed, he tries to breathe on his own. That will But the machine will be pumping him the required amount of air that will provide him, that may irritate him, that might have some adverse effect. So as a result, you will have to paralyze the patient, and you will have to give him the controlled mode of ventilation. Now we will see the procedure, the same procedure which I have said. So from the machine, the fresh gas enters the circuit. What does fresh gas contains? It contains these things. It contains nitrous oxide, it contains oxygen, and it contains deuterium. Okay, now the fresh gas will enter the alveoli of the patient. Now then the expiratory gases are generated. What are the expiratory gases generated? Nitrous oxide, oxygen, deuterium, and carbon dioxide are the expiratory gases which are generated. So in this, apart from carbon dioxide, all the others can be used, right? These all the gases are removed out into the atmosphere completely, okay, from the expiratory valve. This is the procedure, the same thing which I have drawn, right? Now what are the advantages of this procedure? The advantages is, the thing is, it is simple and it is lightweight. You don't need to do, it doesn't have lots of valves and stuff. It is lightweight and simple circuit, so you can easily take it to other hospitals, or it can easily be carried. So it is a portable circuit. Then we have disadvantages. So what are the disadvantages? Obviously there is gas wastage. Okay, so this is less economical. I have already told you, there will be OT and atmospheric pollution, right? And you will have to maintain the continuous gas outflow. So you will have to maintain the continuous fresh gas outflow. If the fresh gas supply has been disconnected in any way, there is no chance of patient to get his breath. So as a result, continuous fresh gas supply is necessary. This is semi-closed circuit.
Thank you and thank you for watching.